Imagine waking up one morning, you're 26 years old, and your ankles and feet are swollen beyond recognition, and you don't know what's going on. You can't go to the bathroom. So you go to the hospital, and you're informed that you're in stage 4 kidney failure. This happened to my partner 2 years ago. This speech is just to inform you guys a little bit about treatment options between Eastern and Western medical practices that involve kidney transplants. These medical advancements are happening every year, but so do medical emergencies. So knowing that there are options available between various medical practices really keeps us informed and aware, especially when our loved ones are involved. I have been looking into this topic and finding credible resources and research on transplant optimization and on various medical perspectives. I'm going to be sharing a little bit of information related to kidney transplants via the Eastern and Western side of the medical coin, and a little bit about what our kidneys are and what they do for us, and some things that should be taken into effect after kidney transplants are actually performed. So, what are the kidneys? Kidneys are two bean-shaped organs about the size of a fist. These organs are used as a filtration system to keep blood in our body clean. This is obviously essential to life. The kidneys are below the rib cage on either side of the spine. When they are functioning properly, they filter about a half a cup of blood every single minute, removing toxins and extra water to be sent out of the body as urine. To keep healthy balances of water, salts, and minerals, the kidneys are remove acid from the body. This filtration system maintains equilibrium for the nerves, muscles, and other body tissues, along with encouraging a healthy blood pressure, strong bones, and proper red blood cell count. When the kidneys fail to work properly, transplants are needed to maintain life. With a foreign organ in the body, our immune systems carry out their function of attacking such unknown bodies. If this is allowed, transplants do not work. So a valuable and necessary portion of aftercare is anti-rejection medical practices that suppress the immune system. Now, after briefing you on the value and function of kidneys, I want to share a bit about treatment being studied by Eastern medicine and how to care for a kidney transplant. Cordyceps are a fungus that have been used in Chinese medicine for quite some time. These are mushrooms that grow inside of insects once the spores have landed on them, and they create filaments called hyphae. The hyphae grow inside of the insect to become mycelium, which eventually consumes the entire insect. These fungi, when injected by humans, can improve immunity, reduce inflammation, improve heart health, and lower blood sugar. And a study held in 2015 produced the idea that cordyceps could be used as an immunosuppressive agent for kidney aftercare and kidney transplants. These immunosuppressive agents are meant to keep the body's immune system from attacking foreign bodies. Though the clinical trial was short and needs much more long-term research, it was found that the use of cordyceps improved graft function and reduced acute rejection episodes. Anemia was reduced and liver function was also enhanced. Long-term studies are desired to make clear the benefits of cordyceps with transplant maintenance, but knowing that there are options to be studied beyond the use of rigorous medications is really hopeful. Next, I'll discuss the medical care for transplants suggested by Western medicine. Post-surgery care for kidney transplants is highly specialized. Patients have a variety of aspects to monitor so that kidneys will function and to prevent the risk of disease in other parts of the body. Western medicine suggests that renal function is monitored closely, along with blood pressure, calcium and phosphorus abnormalities, anemia, acidosis, and lipid counts. Most often, patients will be given medicine that help prevent hyperhidrosis, which is high blood pressure. A huge contribution to survival rate in Western transplants is the use of immunosuppressive agents. These drugs are meant to lower the body's ability to reject a transplant post-surgery. The only time that a patient may not have to take anti-rejection medicine is if their donor was a twin or somehow an exact match. In conclusion, there's still much to learn about kidney transplants since the first one in 1993, but as medicine continues to evolve, I imagine more success rates and transplants, and the discovery of ways that will allow transplants to live in the body without reliance on handfuls of meds to keep them functioning. I have shared a bit about the purpose of kidneys in our bodies and how Eastern and Western medicine may be discovering diverse ways for optional function. Medical emergencies can affect us or the ones we love at any time. Keeping ourselves aware of the practice it takes to continue caring for ourselves and others, especially after transplant surgery, can benefit lifelong health, which absolutely everyone deserves. You never know who can be affected by organ failure or transplants. Would have never suspected someone who was 230 pounds, 6'7", with a healthy build and active lifestyle would have ever needed a kidney transplant at the age of 26. But alas, the most important connection I've made in this lifetime is with my partner, who I now consider to be one of the strongest people I know. Thanks for listening. Have a great day.